Okay. Well, good morning. I want to open up with a few stats since the weekend. Today, more than 100,000 Iowans have now tested for COVID-19 for a per capita rate of 1 in 31 Iowans tested, and that is unique tests. There's no duplications. 7,324 Iowans have recovered for a recovery rate of 49%. Hospitalizations remain stable, and it's been 18 days since we reported Iowa's highest positive cases, and days to double is now at 21 days. We continue to trend in the right direction, further validating that the time is right to move into the recovery phase and begin reopening Iowa. Over the weekend, some Iowans went out to eat at a local restaurant, worked out at their gym, or finally got a haircut. Others chose to remain home and wait a little longer before venturing out in this way, and some businesses decided to take additional time before reopening to ensure they and their staff are prepared to implement preventative measures designed to protect themselves and their customers. Regardless of whether you're ready to resume some of your normal activities or choosing to wait, we respect that decision. Only you know what's best for you and your family. The decision to ease restrictions that allow some businesses to reopen at limited capacity is not a mandate to do so, nor is it a requirement that Iowans dine out, shop, or do anything they're not ready to do. I've asked everyone to exercise personal responsibility from the very beginning. For the business owners that are eager to open their doors, bring their employees back to work, and begin doing business again, I'm confident that they're doing so in a safe and responsible way. Their livelihoods are on the line, and they aren't willing to risk the health of their staff or their customers, which is oftentimes like family, just as I'm not willing to risk the health of Iowans or the health of our economy. Today begins week 11 since COVID-19 was confirmed in Iowa. We're at a point where we can and must strike a balance between managing virus activity for the long term and getting our economy up and running again. It's not a matter of prioritizing one over the other. It's about prioritizing both. The long-term consequences of keeping businesses closed are far-reaching and could have an even greater impact on Iowans than the virus itself. That's why we've implemented an aggressive testing strategy that allows us to monitor virus activity across the state and deploy targeted strategies right down to a zip code to help contain and manage it. Expanding testing has also generated significantly more data, better enabling evidence-based decision-making in real time. While we do refer to models and projections from external partners and other resources and appreciate the information that they provide, we know they're based on assumptions and a certain point in time. So we rely more heavily on our real-time data and our expert team of epidemiologists, the Department of Public Health, who are all studying it every day, while also consulting with their colleagues nationally, including the CDC and the Coronavirus Task Force. We're also sharing this data with Iowans so that they have a better understanding of how it's driving decisions that affect them. Several days ago, we updated the data dashboard on coronavirus.iowa.gov. so Iowans could have access to more of the data we're collecting and tracking. Last week, the update earned us an A+ from the COVID Tracking Project. Iowa is one of just 10 states that earned the top grade for the quality of our COVID-19 data reporting. Today, I'm pleased to share that we're raising the bar even higher. Later this afternoon, we'll be implementing yet another update to our data dashboard and sharing even more information with Iowans. This morning, I want to provide a preview of some of the new data and features that will be included. Then tomorrow, after you've had a chance to see it, we'll provide a more detailed demonstration. So the biggest change you'll notice is the case counts will now be updated in real time throughout the day so that you'll be able to see the numbers coming in on a same-day basis. Previously, we scheduled updates to happen at a specific time each day so that new positive and negative cases could be reported daily either at my press conference or by the media. Because we're now moving to rolling updates in real time, the need to provide new daily case counts is obsolete. You'll be able to see exactly where the numbers stand whenever you decide to check the website. If you're tracking the information closely, you'll also see that daily case counts and other data can change over time, and this is due to the case investigation process. For example, when lab results come in overnight, there may be some that reported as positive cases for the current day, but through the case investigation, it's learned that some cases were actually identified before the cutoff at 11:59. So a correction is made, and those cases are moved to the previous day's count. In this situation, the total number of all positive cases is accurate and remains the same, but the daily numbers shift slightly. This can also happen with other information as more details are learned through case investigation. For example, the county of residence for a positive case may have been initially reported incorrectly, but the mistake was later discovered through the case investigation process and corrected to attribute the case to individual's true county of residence. The data is fluid, and you may notice some of these changes depending on what you're tracking. While this is a noticeable change from how the information has been shared previously, I believe the transparency of providing it to you in real time makes the information even more valuable and relevant. Other new additions that you'll notice is a trend line for the percent of all individuals who've tested positive compared to the total number of people tested on any given day. A trend line for the percentage of individuals who tested positive by county, and the ratio of persons tested by county, and positive case volumes by county over a 14-day and a rolling 3-day average. We're also providing data on serology testing, including the number of positive serology tests by county. Tomorrow, Dr. Pradati will talk more about the use of serology testing and what we're learning from that. And in addition to that, we've also updated the long-term care dashboard to include reporting on current outbreaks, positive cases, and number of individuals who have recovered and more. A breakdown of positive cases by those who are symptomatic versus asymptomatic, and positive cases by race, ethnicity, gender, and age group. So I hope that you'll take some time to explore the site today at coronavirus.iowa.gov, and tomorrow we'll demonstrate some of the new functionality. Finally, I'm also pleased to report that a new dedicated call center for Test Iowa is up and running today. The call center is staffed by nurses who can assist Iowans who've completed an assessment or been tested and have questions about the Test Iowa process, issues with getting their results, or what to do if they've tested positive. The call center can answer questions about assessments, but they can't assist Iowans with filling it out. If you can't take the assessment because you don't have access to an internet, ask a trusted friend or a family member to assist you. The number for Test Iowa Call Center is provided on the website within the assessment and in follow-up email communication from Test Iowa. Iowans should continue to call 211 with any other questions related to COVID-19, including questions about their health concerns, preventative health measures, assistance from state agencies, or business reopenings. And finally, this morning, I know Iowa parents are concerned about the emerging pediatric illness tied to COVID-19. And I've asked Dr. Pradati to join me and provide an update about multi-system inflammatory syndrome. Dr. Pradati?
Thank you, Governor Reynolds. I'd like to take a few moments to talk a bit about this newly recognized condition that we're calling multi-system inflammatory syndrome in children. This is something that we're following very closely in order to learn more about. Now, so far, children have made up a smaller proportion of the reported COVID-19 cases. And thankfully, reports of children becoming seriously ill are very rare. However, late last week, the Centers for Disease Control and Prevention shared a message alerting healthcare providers and public health professionals to this new kind of inflammatory syndrome that seems to be associated with COVID-19. Friday afternoon, the Iowa Department of Public Health did receive 2 potential reports of this new syndrome. These reports are in children in eastern Iowa who are currently stable, and we're working with our clinical and local public health providers to gather more information. Now, what we know so far about this syndrome is that it appears to cause fever and signs of inflammation throughout the body. You might have heard this compared to another kind of rare inflammatory condition in children that we call Kawasaki disease. These 2 syndromes appear similar in that they both seem to cause what we call post-infectious inflammation, meaning that several weeks after a likely infection, people might develop signs of inflammation throughout the body. We do think that this is a new condition, though, distinct from Kawasaki disease. Now, like so many things with this response, this is an example of a place where we need to learn more. So in order to help do that, Director Claiborne and myself have made this new disease a mandatory reportable condition here in the state of Iowa. This allows us to receive these reports from clinicians and public health professionals. It allows us to gather more information and better understand this condition and how we can manage it. In the meantime, we want to remind children and their families here in Iowa to continue to do all the good things that you're already doing. That includes following public health guidance, things like frequent hand washing, social distancing, and the use of cloth face coverings when you're unable to maintain a distance of 6 feet. And finally, we just want to remind everyone, including children, that it's important to stay up to date with your routine care, including vaccines. With that, I'll turn it back to you, Governor Reynolds.
Thank you, Dr. Padati, and I appreciate the work that you and your team are doing in the Department of Public Health to keep Iowans informed about this important issue. And with that, we'll open it up for questions.
We're going to go to Zach at Channel 5 to start us off.
Thank you. The LSA has released their revenue and budget implications of COVID-19. Tax revenue into the general fund is down over $400 million. That's 36% drop between March 19th and May 5th. So do you have an idea on how the state budget may change? Do you plan on any cuts? And lastly, where is your budget? In April, you said you'd have it ready in April.
Yeah, and actually, we've been working with the legislature, so we're working on our budget and starting to go over the numbers. And I think LSA, if you read the entire report, said a lot of that was attributed to the deferred tax payments that were due in April that have been deferred until July. And so it's hard to tell exactly at this point what the overall impact of COVID-19 will have on the state budget. But it's why it's important to, in a very safe and responsible way, start to not only protect the health of Iowans, but to look at the health of our economy as well, and start to put very limited and start to ease some of the restrictions that we have on businesses so that they can, again, start to open up the economy and do it in a safe and responsible way. So we're working with the legislature. They'll be back on June, and we're having those conversations, and we're going to continue to wait until we'll have a better idea by the end of May, and then as we move through the following months to see what the impact of those deferred tax payments have on the overall budget.
Dave Price, Channel 13.
Good morning, Governor. Can you help people understand? Obviously, they know a lot of people who've been hurting when so much of the economy was shut down for so long. Leading up to this, there was the talk about peaks. And the way you have reopened things, much has been reopened before we got past peak hospitalizations, peak deaths. Do you think now, does the peak period matter, or do you have other data that you use that convinced you that it was safer to go ahead and reopen before we moved well past those?
So I want to remind Iowans that we did it, we didn't just rip off the Band-Aid. We're easing mitigation efforts. So as we start to open up our economy, a lot of times we're doing it at 50% capacity. We're asking that the businesses continue to practice social distancing. We're asking that Iowans, when they go outside, to practice social distancing. And if they're at a place where they don't think they can, to have a face covering with them so that they can put a face covering on. As you've witnessed, as you start to go go to businesses across the state, they also are taking very proactive measures and requiring maybe Iowans to wear a face covering if they're going to shop at their place of business. You see restaurants that are really being thoughtful and taking the time to make sure that they're meeting all of the Department of Public Health guidelines and the restrictions that have been put in place that allows them to open back up, because they want to make sure that they're protecting the health not only of their employees but the health of Iowans as well. And so I've also said, we started with it's stabilize, recover, and grow. And stabilization, it was all about protecting the health of Iowans, making sure that we were managing our healthcare resources, working to, by the mitigation efforts that we put in place, flatten the curve and not overwhelm our healthcare system. And we've been able to do that, and we were able to demonstrate that and continue to demonstrate that to Iowans on a daily basis. And so because of that, and with the next step that we were able to take, which was significantly increasing our testing capacity in the state of Iowa, as well as putting in place a robust case investigation process so that we can collect real-time data, take a look at where we're seeing potentially, increased virus activity, maybe a cluster of activity, or as we're doing some proactive and very strategic targeted testing in some of our manufacturing facilities and our processing plants. We've been able to see, how that impacts the overall workforce, how we can separate those that are positive, isolate them, get them on a road to recovery, look at separating the shifts, making sure that we have adequate PPE, making sure that the facility is taking all the precautions that the Department of Public Health has put forward in the guidance, working with, when it comes to the processing facilities, working with OSHA and the CDC to jointly put together the requirements for the facility. So what we've seen is businesses being responsible, Iowans being responsible, and in addition, we're doing it in a phased-in approach, and so we'll continue to monitor the data as we continue to ease restrictions. You heard me say in my opening comments that it's been 18 days since we reported Iowa's highest positive cases. The days to double now are at 21 days, which really speaks to the slowing of the spread. That's very positive. Our positivity rate overall today is 14.5%, and I think it's about it was about 8.5% yesterday. So we're seeing some really positive things from that as well. And we're going to continue to monitor it on a daily basis and continue to see how the phased-in process of opening up Iowa is, how we're managing and working through that.
Des Moines Register, go ahead.
Thank you, Governor. One of the protections set to expire in your proclamation next week is a moratorium on evictions and utility shutoffs.
Yeah.
We've heard from some groups who are expecting an influx of evictions after that expires. With unemployment still in record territory and the virus still spreading, do you plan to extend that? And if not, what steps should be taken to keep vulnerable people in their homes during this time?
So we're actually, we're looking in that in conjunction and working with the Iowa Economic Development Authority to maybe put in some optional grants that would apply for the apartment owners. So we're looking at a couple different scenarios on how we move forward with that to make sure that we're not removing that too soon, that we're continuing to work with Iowans as we begin to open up our economy and help Iowans get the skills to fill some of the jobs that are available as we begin to move forward. So while we haven't made a decision yet, we're continuing to look at all aspects of the declaration that will expire next week and how we can move forward, again, in a responsible way, being mindful of Iowans, the impact that the pandemic has had on Iowans across the state.
Rod, the Gazette, go ahead.
Thank you, Governor. Iowa's approaching its first major holiday with COVID when the Memorial Day weekend begins on Friday. Louisiana saw a big spike with Mardi Gras earlier this spring. Our readers are wondering, with it being a major camping weekend, will things like restrooms and playgrounds be open in parks with periodic cleanings? And is there concern Iowa will see a spike in positive COVID cases in the aftermath of the holiday outing?
Yeah, well, we're going to continue to ask Iowans to be responsible and to practice good hygiene. So if they're sick, they need to stay home. When you're out in public, you need to continue to practice social distancing. Campgrounds meet that criteria. We'll take a look at maybe, what that entails as far as the restrooms, and I don't believe we have any indication of opening up the campground or the playgrounds at this point. But we are looking at a lot of data this week, especially as we move into the overall expiration of the declaration next week. So we're looking at a lot of those different requirements to see what's necessary to continue with, and if there's additional things that we can ease up on. Do you have anything to add to that? Okay. And the other thing is, remember that if you're a vulnerable Iowan with underlying conditions, we are not recommending at this time that you change your habits. You should continue to stay home and limit your trips to essential errands, and make sure that you're cognizant of your surroundings when you do that, and you're wearing a face covering. So those still remain the same. We still have in place limiting social gatherings to 10 or less. So while we're easing some restrictions, I think we still have some practical guidelines in place that will give Iowans an opportunity to get out there and enjoy the holiday and enjoy their family, but to do it in a responsible manner.
Caroline, go ahead.
Good morning, Governor. Can you describe the process from when a Test Iowa test is collected at a Test Iowa site to the moment it gets to county public health departments, the results?
Yeah.
Thank you, Caroline. So the sample gets transmitted to the state hygienic lab, which runs a sample and gets a test result. That information goes into the Qualtrics system at the state hygienic lab, and then that data is transferred to the state health department, and it gets entered into the disease surveillance system. And then that gets commingled with all of the other test results that are received from a variety of different labs, including the state hygienic lab and a number of other national reference laboratories, in addition to laboratories at hospital systems in our state. And then those test results then get transmitted back to the website dashboard so that we can provide our daily case counts.
And they're going to be getting that on a more timely basis with the updates, right? Yeah. Thank you. And those transfers through the testing sites are made periodically throughout the day, so we can really chime the workflow at the state hygienic lab, so we can continue to help just with the timing of the tests coming in and meeting the capacity that we have, that we can run through the state hygienic lab.
We're going to go to Chris at KCCI.
Hi there. So was wondering what the status is, or what you're seeing from the use of remdesivir. Curious how that's been going.
Dr. Padati, would you want to take that question? It was in reference to remdesivir.
Yes, thank you, Governor. I don't have any specific updates to share with you in terms of outcomes for the use so far here, but I can tell you that we continue to work with a group of clinicians, pharmacists, public health, and clinical personnel throughout the state to keep an eye on lessons learned, and when we have more to share, we can do that.
Thank you.
Next question, we're going to go to Grant at Iowa Public Radio.
Yeah, my question is, with this inflammatory syndrome that is coming up in children, how should schools take that into account as they prepare to make their returning learning plans?
Yeah, so, as Dr. Padati said, well, Dr. Padati, do you want to answer that?
Sure. So I think it's an important thing to recognize, again, just as we have all along, that as we learn more, we need to continue to collaborate to better understand these things and what we can do to manage them. And this is another example of a place that we're working very closely with clinical and public health partners, not just here in Iowa, but across the United States, and of course with our federal partners, to gather more information. And just like everything else, we would want to encourage people to continue to follow the public health recommendations that we've been making that help keep people healthy and safe. And it does include things like the hand washing and us working very closely with a variety of groups or settings to help make sure that as we bring people back to activities, we do it in a safe way, in a way where we can keep an eye on any additional concerns or new things that might arise.
Great. Kay Henderson, Radio Iowa.
Governor, given the tragically high mortality rate in nursing homes, last Monday, Vice President Pence asked states to test all residents and staff at nursing homes within 2 weeks. That would mean by May 23rd or maybe Sunday the 25th. There are 23,000 residents and 55,000 staff in Iowa nursing homes. When and how will those 78,000 Iowans be tested?
Well, actually, we're off to a really good start, and we started this a long time ago. So Iowa has been very proactive in really working with our long-term care facilities and the staff, and I'm really, really proud of our team, the Department of Public Health, to really put this strategy together. And then later this week, I'll be laying out a complete testing strategy that we'll be implementing moving forward. But remember, I indicated last week that, we've had done some testing in over 420 facilities, so we're about at 95%, and we're going to continue to work with facilities to build that out. We have a strike team that's going into Cerro Gordo this week. Worth County will be able to participate in that. We're getting a lot of requests from other communities to implement something similar to what Dubuque did, where you do a community test site which incorporates the long-term care facilities. Staff, mostly, it works better. We have to go into the facilities to do the residents testing, but you've been very good about being proactive. Do you have anything that you want to add to that, maybe?
I was just going to say that because as Governor Reynolds mentioned, if the staff are being tested externally outside of the facility, we are offering to provide those facilities with enough supplies so that they can test all of their residents as well.
Yes, they can do that. That's right.
We're going to take 2 more questions. Lynn, Iowa Capital Dispatch.
Hi, Governor. Now that more Iowans are able to go and return to work, I know you talked about earlier that most businesses are, conducting things in a safe manner, but what should workers do if they feel unsafe about their working environment and any possible spread of COVID-19 when they start returning?
Yep, so remember we have that hotline, that toll-free number where Iowans can go on. We've provided some assistance to walk through any concerns that they may have, and if you go to coronavirus.iowa.gov, you'll see the number there that they can call if they have concerns about that, their safety not being met.
Last question, David Pitt, Associated Press.
Yes, Governor, thank you. My question centers on the Iowa OSHA response to complaints of concerns at the Perry Tyson plant. I believe our data shows that we received from the state that the first complaint was around April 11th, and it took 9 days for OSHA to respond to that, and in another week to get, I think, response back from Tyson. Are you satisfied with those types of responses? And I know we'll start looking back at how we dealt with some of this as we move forward, and I just wonder how you take that.
Well, David, I'd have to look at the specifics on that. I'm not 100% sure, so I can review that after the press conference and be more than happy to get back to you. We have an incredible team that's working incredibly hard. I want to just give a shout out to the state workers. They are working 24/7, 7 days a week to really meet the needs of Iowans. But, there are times when we fall short, and if that's the case and we can do better, we're going to do better. So we'll look through the information that you're speaking to, and we'll be sure and get back to you, get a response back to you on that. Okay?
Thanks, everyone.